Finding blood in your urine is reason enough to stress you out. While in many instances it's perfectly harmless, doctors say you should leave it to them to determine. Here's the latest in this week's Positively Healthy. Seeing blood in your urine is most certainly an eye-opening occurrence, but it's not always enough to move people to action.
It's interesting. There's patients who, the moment they see blood, they're scheduling a visit and they're in the office and they are alarmed. And there's patients who actually dismiss it and they say, well, I saw it once 6 months ago and then it came back, so that's why I finally came in.
Dr. Alexander Rosen is a board-certified urologist with Physicians Regional Medical Group. He often sees this broad spectrum of reactions when it comes to hematuria, which is a medical term for blood in the urine. It can take two forms.
It can be microscopic, meaning you can't see it to the naked eye, but we see it on testing, or it can be gross hematuria, which just means you see red or pink urine.
You're less likely to learn the cause with microscopic hematuria. It's perfectly natural for some people and doesn't pose a problem. Once blood is visual, doctors have good success in determining its origin.
Whether it's a little blood vessel in the bladder or in a man in the prostate that's bleeding, kidney stones, urinary tract infections, and then the big one that we're always ruling out is cancer.
Blood in the urine is a red flag for urinary cancers, especially kidney and bladder. Even without other symptoms, it may lead doctors to make a potentially life-saving diagnosis.
The reason we always do an evaluation for either type of hematuria is that we have to rule out cancer. And you certainly find them with very minimal presentation. We take a look in the bladder as part of the workup with a small camera and you can find a bladder tumor.
While hematuria may be harmless, the takeaway is it shouldn't be ignored.
Never consider any kind of blood in the urine to be normal until you've talked with a urologist to tell you about it.